Okay, this is Melinda. Hi, Melinda. How are you?
I'm good, thank you.
All right, good. And we've got the Wellness Pro on you right now. As you can see, we have the cylinders on her. And she's allowed us to go ahead and videotape her today to show her the difference with the Wellness Pro. And I'm just going to show you the Wellness Pro right here. This is an electrical frequency, radio frequency sound device. And it has pulsed technology, deep pulse technology. Every 3 minutes, that frequency changes in order for the body to help heal itself. And right now, I'm going to ask you right now, what was your pain level when you sat down here, Melinda?
It was a 7.
It was a 7, okay. So what I'm going to do is at the end, we've done about 1 minute right now. And we're going to ask you at the end of that 12 minutes, we're going to ask how you're feeling right now, okay? So describe how you felt when I started putting those cylinders on you and the frequency change that you experienced.
When you put the cylinders in my hands, I just felt
and you could
I felt
feel
the vibration, yeah. And right now it's just changed, and so it kind of alerted me. It's a different vibration, and now I feel it in my back.
Oh, good.
Which I wasn't feeling it so much before in my back.
Okay.
So it's not a unpleasant or vibration. It's a I don't know how to describe it, but it's more like a sensation.
Okay.
It's a sensation more than a vibration to me.
Okay, that's fine. So when you first came in, what was your pain level, Melinda?
I would say it was a 7 or an 8.
Okay.
Yeah.
Okay, and so when we're done in 12 minutes, we're going to ask you again what you feel. And just keep in mind that you may not feel a difference. Usually 95 to 99% will notice a difference right away, but you may be that small percentage. And then tomorrow when you wake up, you may feel, at that point you may not have any pain at all, or maybe a reduced amount of pain, okay? And then the following day, after 48 hours, you can actually feel the difference.
Oh, good, okay.
Yeah, so that's what we're going to do is we're going to ask you now, and we'll see where your pain level is when we're done. And then what I want you to do tomorrow, I'll follow up with you in 2 days. And then at that point, you can tell me how you're feeling too.
Okay.
So cool.
Okay.
So
does the pain, does it move around my back?
yes,
Okay, because I feel that.
yes, absolutely. And that's what it's doing. It's hitting your nerves. It's getting the muscles. It's getting the tendons. And it's actually doing a bone spur code, which is calcium buildup. Yeah, did it change?
Yeah.
I know every 3 minutes, literally that frequency will change because it has 5 different waveforms and it has over 1 million frequency codes. So every 3 minutes that code changes. And so we always make sure that you're good with that particular. We only put it up so that you can feel it. And sometimes you may not feel anything and it's still working.
Yeah, this one feels different and it's more of a rush.
Now you'll find also that your emotions will even change because it has things like PTSD codes in it. So it actually raises your emotions to help your body to heal because a lot of things is about emotions. If you're stressed out, you're raising your cortisol levels, then you're having back issues and things like that.
Right.
And so this literally will help you to get rid of pain and inflammation of any kind in your body, which that's what our whole body is, pain or inflammation.
Right.
So it gets to the cause, the root cause, as opposed to treating the symptoms. And that's what I love about this. If we have a doctor's diagnosis, and we can go ahead and treat you wherever you need and put those cylinders in your hands or put the pads under your feet or on your back, shoulders, neck, wherever that pain is going on, and then you will actually feel better once we do that. And you can stack the codes, and you can do several codes. So if, like, say you have back pain right now, we also put slip disc codes in there. And what we're finding out a lot of times is those slip discs is caused from inflammation, which could be bacterial or viral or staph infection, and this works with all those inflammations. So it will literally help you reduce those inflammations as well.
So does this give you a readout of any sort?
No, it does not.
Okay.
Yeah. Yeah, we usually will deal with your doctor's diagnosis, or I also work with a frequency program called a Zytoscan, and it literally will show me everything that's going on in your body with bacterial, viral, if you've gotten any vaccinations that you're having issues with. Even as a childhood, it shows up everything in your body. And then I can help clients all over the country because they can buy a hand scan. They put their hand on this scan, which is right over here. There it is. They put their hand on that scan, and literally it will read their whole system. And I have medical doctors now that are telling me that that is more accurate than lab tests. And so they prefer to do the scanning because they've already used the lab tests for 15, 20 years, and they're finding that that's actually more accurate. And that's called like a biofeedback machine or skin galvanization program. So I offer that today too for $30.
I needed that 3 months ago.
Oh, well, there you go. Well, we got it right here. So it will actually show me the organs. It'll show me what organs are being affected. It'll show me your emotions. It'll show me what stresses you've got going on right now, emotionally as well as environmental stresses. It'll show me if you're dealing with heavy metals. Show me if you're dealing with parasites, fungal, bacterial, viral. It's actually incredible. And that's something, doctors are great for what they do, but they can't get to the bacteria or the viral infections. And that's what that will do. It'll show autoimmune issues. So it'll show Lyme, or, it will make suggestions, because we can't diagnose. It will make suggestions, and then I can help you with homeopathics that will literally give you immunity for Lyme disease or Epstein-Barr syndrome, which usually those go together. A lot of people are not aware of that. Also breast cancer. It's usually Epstein-Barr. And people are not aware of that.
I wasn't aware of that.
Yeah. That's something I learned from another naturopath recently. And she treats those people that have cancer. And it's helped with their, reducing it and eventually helping them to eliminate it. So it's done with frequency. Homeopathic frequency, herbs are frequency, Chinese herbs, all that can help you. And this amazing machine, which literally gets rid of pain or inflammation in any part of the body, using the cylinders in the hands, which we have these new carbon ones now, and then also with the pads that are carbon also that we use for the back or the knees. We use the smaller ones for the knees, and that helps as well. So, all right, so how are we feeling now as far as pain level? Have you noticed a difference at all?
I do. I don't feel the pain is as centralized in my lower back as it was.
Great.
So, but I do feel like it's shifting out. Does that make sense?
Uh-huh.
Yeah.
Absolutely. That's interesting because you're the second person that said that to me. So what it does is it treats different areas of your back according to the muscles, the tendons, the nerves, and that's what it's doing right now. And like I said, it even has parasite codes in it because doctors are not even aware that parasites can live in the muscles, and they can't find that on their lab tests, because they can live in the tissues and the muscles. So so we have now just finished the program. So if you could give me an idea now, you said you came in with a
7 or an 8.
7 or 8, okay.
7 and 8, yeah.
And where do you feel now?
I would say it's like a 3, maybe.
Fabulous.
Yeah.
Fabulous. I don't know if you can see me, but fabulous. Because that shows in just 12 minutes, literally, you've already made a difference, right?
Right. All right.
So if you feel that this could help you with something like this, would this be something you'd consider to take home with you and actually treat yourself anytime you need it?
Oh, yeah. Most definitely.
All right.
It's a great idea.
Thank you. I appreciate that. And Miss Melinda is a reflexologist like myself, so she knows how important frequency is, because that's what reflexology is, right?
That's right.
You know, we treat each other from the all the way down from the feet all the way up to the top of the head.
Inside out.
Inside out, absolutely. And this is great for any massage therapist or anybody that uses their hands a lot. Literally can help reduce and eliminate carpal tunnel, because those cylinders literally work all the way up to the top of the brain. They work through the elbows. That's where reflexologists have a lot of issues. That's where massage therapists have a lot of issues, because they're going through their whole muscles and tendons and nerves all the way up through the top of their shoulders. And this would help you to be able to keep doing that profession as long as you want, right? And isn't that why you said you quit?
That's why I quit doing it. Yeah, I couldn't take the pain anymore. Yeah.
Right. So if you would have had something like this, do you think you might have kept doing it for a while?
I would have kept on, yeah.
Yeah, and you could use it in your practice.
I'd be a successful reflexologist.
Absolutely. All right, well, thank you very much. I appreciate your time here. Okay, Miss Melinda, you just came back again. Thank you for coming.
Yes, I walked around
Yeah?
and just to see, and there's like no pain right now.
All
Yeah.
right. And that happened after you left.
After I left.
Fabulous.
Just minutes ago.
Wow. Thank you for sharing that. Yes, I appreciate that.
You gotta